Hi everybody, Dr. Randy, Kalkstein Family Chiropractic. I have Scott in the office today. Scott's a postal worker. He's walking anywhere from 6 to 18 miles a day. So he's been a regular patient in the office over the past year or so. And we adjust everything on him. So I wanted to shoot a video because we're going to adjust him full spine. We're going to do some flexion distraction. We're going to do decompression with his neck, adjust his knees, shoulders, elbows, wrists, and we're going to give him the works. All right, ready? Face down for him. They shut down Planet Fitness?
I'm hearing
they're going to. So he's a little out in his right. So his right. One of the things we do, kind of every visit, is do a quick motion palpation. We do a leg check. His right leg's short, meaning his pelvis is a little rotated, and that's something just that can happen over the course of just day-to-day stuff. So there's a lot of drop work in the office. It's a loud drop, but allows us to restore normal pelvic and low back mechanics. So it's super comfortable for the patient. They can lay face down, not move, not have to be twisted, and the drop does all the work. We're right on his right SI joint. Adjusting his right SI joint, which is an extension, back into flexion. Basically restoring mechanics to his hips so they function right. And we get some leg length come back. Now, his came back. The key is getting it to hold now. So a lot of times, too, we see a lot of hip problems in the office. Besides the drop work, we'll do soft tissue on some of the muscles that are real tight. And right in through here, piriformis, glute med, his IT band comes up. A lot of these things are effective for a lot of people. We can kind of manually get right on them. And just holding this pressure, and sometimes we'll even do a little bit of ART where we're kind of hold a muscle and then take it through its range of motion to get a little extra movement in there. Good. Just that alone with the drop. Just bring that hip back. And he obviously works out a ton, so he's got really developed back paraspinal muscles. A lot of the guys and gals who work out a lot, it's a stressor. I tell everybody, it's great for you. It's one of the best things you can do for your health, but it's a stressor on your body. Getting adjusted, if you're like to stay very active, is a way you can, prevent injury, and you can continue to stay active and work out and do things you like to do without having a lot of setbacks. Take a nice deep breath in for me. Scott, exhale. Good, Scott. He moves real easy again. He's been getting adjusted for a while, so it can adjust real easy through there. More drop work here. Take a nice deep breath in again. Exhale. Good. All right, go on your side, face to me. Let's go right to the rest of his low back adjustment. Sling all the way up. Take a nice deep breath in. Exhale. That's it. Other side. Breath in again. Let's go. Exhale. Good. We're just contacting his hips. Good. Good. Go face up. Just put a pillow under his knees just to flatten his low back. I'll pick your knees up. Just to relax his low back. Adjust his neck. A lot of people, you may know you have some neck pain, or you may have it from time to time. It may come and go. When you come in to get adjusted and you come in to get checked, we're palpating the tissue along your spine called your paraspinal tissue muscles, and people don't realize how sore, how tender they really are until someone presses on it. It's not a hard pressure, but it's just enough to feel for where he needs to be adjusted. In some of these spots, for a lot of patients, especially new patients, they're super tender because no one's ever really palpated their spine to find out where they're having their problems. These joints that are restricted and tight and sore, they're basically the cause of your problem. So instead of just masking your symptoms or just living with that, Because the danger is there, you're gonna have a lot of scar tissue build up. You're gonna have more wear and tear build up in your spine. And you don't want that, because over time that's gonna limit you how you function, and it's gonna cause more chronic pain. The way to handle this is to be preventative and proactive with it. So he's tight there, so I'm just gonna adjust his neck this way. Perfect. And he's out on this side, a little bit lower. Perfect. And again, we really like this decompression for the cut it for me. I know a lot of videos and chiros are doing this and like giving a big yank. We do a little bit for you, right? Don't we get a little bit? Yeah, we get a little bit with Scott. But even just that pull decompresses the cervical spine down to his mid back, and some patients even feel it in their low back when their knees are up like that. You know, if you're down, if you're looking at a computer all day, if you're doing paperwork, or even like, you know, it's a lot, it's a big toll on your neck. There it is. So we can get a little pop that way. I'm gonna do his mid back one more time, cross these arms. Big hug, more towards me. Pull back on my hand, buddy. And even more in there. We need to get better sound on that so we can hear that. All right, so that's his full spine adjustment. Did his right side, did his low back, everything moved great today. Now we're gonna do his extremity. Hang on to the table. So we're gonna do some long axis traction, get the hip and knee, just relax there, Scott. Good, and this one. Good. You can sit all the way up for me. Oh, your feet, lay face down. So a lot of foot problems in the office. He's on his feet all day long, obviously. So I have a couple different activators I use, and a couple different ways we can adjust the foot. What was your problem? You have plantar fasciitis, or originally that we were working on?
Yeah.
Or just pain?
Always pain, because I've been walking like 20 miles in work for like 6-7 years now.
A lot of foot pain. So we started working on his feet a couple months ago, and it's been helping you, right? It's been.
Oh yeah.
You know,
oh yeah.
So we can motion, just like we're motioning the spine, finding for areas of restriction. We can motion the metatarsals of the foot. And then we always use our activator tools on the plantar fascia. So where his plantar fascia connects to his calcaneus bone, we'll work on that a little bit. And we'll hit the arches of his foot. And again, we'll motion those joints. Kind of roll out the calcaneus a little bit. We'll hold the calcaneus and roll out the navicular a little bit. One more time. Let's see if we can just get that. Good. He's pretty good there. So. Okay, first metatarsal to go. So we do that on each foot on him on each visit. So his calcaneus bone, his plantar, that ligament attaches to the base of your calcaneus here, and then runs up and spreads out over your metatarsals. So we kind of motion these. One more here, Scott. There we go. Roll out his calcaneus a little bit. Get a lot of popping, a lot of adhesions to break up in his ankle. Again, roll out the navicular and the cuboid this way while we stabilize the calcaneus. Get his first metatarsal to move a little bit. Good. A little more activator work. This is not our regular activator. That one's getting fixed, but this does the job. Just puts an impulse into that arch. If you're having foot problems, definitely come in. Again, people don't usually come in with it. They usually goes hand in hand with their low back or hip, but it's something we can help you with, absolutely. All right, come on up. Wrists, shoulders, elbows.
Yeah.
It's in this shoulder adjustment a bunch here. We're just gonna let it. That's for the glenohumeral joint. Everybody's shoulders become too rounded. That's one way we can fix that. And adjust his backside shoulder. So ulnar and radius. Good. That's pretty good. And then wrist. Could really help with carpal tunnel syndrome or any type of wrist pain. Lean back away a little bit for me. Good, that already popped, right?
Mm-hmm.
Thing here. Ulnar, radial joint. Lean back away a little bit. Good. You do knees too?
Mm-hmm.
Wrist. Now we're gonna do his knees. So you can do these a lot of different ways. I like to do them sitting up. Again, we do this on a lot of patients, and it's giving people a ton of relief for knee pain. It's more of a mobilization than adjustment. So I'm gonna contact different areas of his knee and the surrounding tissue, and we're just gonna mobilize it. And I'm gonna put a little bit of force in each way, and a little bit of distraction. You tender there at all?
Yeah, I feel like I hurt my MCL, honestly.
Did you do something recently?
Yeah, I've been waiting it for 2 weeks. It still hasn't come. I can't bend it fully at 90 with power.
I can tell. Yeah, he's more of a shit.
Yeah.
So he did something recently too, and he does feel a little tighter. Good. This is
That was
good.
the exact point too. That's
Good. This
crazy.
is good. Excuse me, for meniscal pain, patellar pain, just general knee sprains or arthritis. Again, it's not a forceful adjustment. It's more of a mobilization to this knee joint. His fibular heads need worked on. We can do that here. That's it. Full spine adjustment. Something we do on him on every visit. Keeps him going, keeps him functional. Chasing his daughters around. And so we'd love to see you in the office. Thanks. Bye.